Well, good afternoon, everyone. Thanks for joining us once again for our Department of Labor and Economic Opportunity webinar series, where we focus in on workplace mental health. As we've been wrapping up 2025 and are heading into the holidays, we have a great presentation today. There's a Q&A box on your screen that you can submit questions to at any time throughout today's presentation. We'll try to get to as many as we can. If you've joined us before, you know it's always difficult to get to them all, but we'll do our best. And if you haven't already, you can sign up for emails on our michigan.gov/workplace mental health page. That also includes all the recordings and all the webinars that we've had, our workplace mental health report, the report we're talking about today, and any other links and access to information or resources that we're using or talking about. As you know, throughout the year, we focus on our 3 pillars of work, being those things that are happening in the workplace, things that are affecting the workplace, and then connections to individual behavioral health supports. And we try to make sure we hit on these throughout the webinar series and throughout our work. So we're highlighting areas of interest and opportunity in any of those 3 pillars. And we have been full steam ahead in what we can do about this phase of our work. And we're going to continue to identify those issues and challenges, but we've also identified tools and other things we can do to improve our workplaces. So today is part 3 of this 3-part series. You'll see some news for what we're going to do in the first quarter of next year pretty soon, but we're going to wrap up our 3-parter. In part 1, if you recall, I shared kind of where we've been over the past few years, where we're going, what we're doing to continue to implement the recommendations of the work group that came out of the report in 2022. Part 2 of our webinar series in November, we announced the launch of our LEADS program, Learn, Educate, Act, Deploy, Study, and how we're recruiting employers to participate in that right now. We've had a great response to that, but we're continuing to have outreach and provide information to employers that are interested in bringing those tools into the workplace, having those interventions in the workplace. And today, just before the webinar, but today we are announcing our new workplace report focused on work, social determinants of health, and stress. So today I'm joined by Lisbeth Iglesias, who recently joined us here at Leo in our efforts. She's an epidemiologist and researcher, and she's worked tirelessly over the last several months to bring you this exciting and important research. And this report is designed to support the continued development of healthy, resilient workplaces and build strong communities in Michigan. The report builds on the knowledge that's out there and provides evidence-based information on the complex interrelation of work and health using public health lenses. We emphasize the role of social determinants of health and highlight the impact of chronic stress on workers' mental and physical health, as you've heard from us before. Recommendations on organizational interventions are in here, and they're in the report as a means to support healthy work environments to propel high-quality jobs, productivity, and a stronger economy here in Michigan. And we do have some other pieces here we wanted to share as you kind of read the report or you listen to the presentation. So we emphasize the integration of mental and physical health as one term, that being well-being, not wellness. Often we think about well-being as like a wellness program. We're using well-being as a broader term, and it means a state of positive functioning and general satisfaction with life that encompasses thriving, actualization, and positive feelings. Wellness alone is about feeling good and maintaining health, while well-being is about thriving and achieving a fulfilling life and access to quality jobs. So we also use the term workers and employees interchangeably in the report and the presentation. So keep that as mind as we roll through. And for now, I'm going to turn it over to Lisbeth. Lisbeth, go ahead.
Thank you, and hello, everyone. I cannot see you, but good afternoon. I'm going to start with the framework that we use to develop this report, and then I will share with you some highlights on survey data and research. So for the report, we apply public health principles because the goal of this initiative on workers' mental health and well-being is to improve the health of all workers in Michigan, and public health is population health. We emphasize the importance of prevention and promotion. These are core tenets of public health. So the prevention of health risk and promotion of occupational safety and health for all workers by creating healthy work environments where workers can be safe, productive, and thrive at their jobs. Another principle of public health is the use of evidence or the implementation of evidence-based approaches. This means the use of the best scientific knowledge to inform programs, policies, and practices to workers' mental health and well-being. by developing collaborations and strengthening partnerships with the stakeholders, including employees, businesses, academia, and policymakers. So really all coming together to contribute and shape to a healthy workforce for people in Michigan. So this is the general framework that we use to develop this report, and includes the vision of this initiative on workers' mental health and well-being. So with this framework in mind, it's important to understand first that work is a key social determinant of health, and social determinants are non-medical factors that have a strong influence on our life and our life expectancy. Examples of social determinants include your socioeconomic position, your access and quality to education, your access and quality to healthcare services, your neighborhood and built environment, your social and community context, and your social networks. And all these factors are intrinsically connected with work. Work is very central to our lives because we spend a third of our lives at working, and more than 2/3 of the population are in the labor force. So this really means that work not only has a great impact in our lives, but it also represents a great opportunity to improve workers' health at the population level if we promote healthy work environments. And this is very important for social determinants because social determinants can influence our life trajectories and impact future generations. For example, a child raised in poverty with limited access to healthy food is more likely or has a higher risk to develop chronic diseases as an adult, and it might be that the well-being of their own children will be impacted by these issues, creating these cycles of disadvantage. So what I want to highlight here is that social determinants can create this long-lasting legacy on health and life opportunities. Now, this is a visual representation of these different social determinants of health that I mentioned. The circles are overlapping to show you this interconnection among these factors with work at the center. And the message here is that social determinants also can create inequities. Because when it comes to factors like income, educational opportunities, job opportunities, or any of these social determinants are not available equally for everyone. And this creates degrees of social and economic disadvantage. And this is a concept in public health that is known as the social gradient and has very important implications for workers' health, because the lower your socioeconomic position, the worse will be your health. And this is a phenomenon that is very well established. The social gradient is very well established in research and has been observed in many different research studies across many different populations here in the US and other countries. And so the importance of all of this, of what I'm saying, is that societies with higher levels of inequalities, in essence, in the distribution of power, money, and resources, are societies that tend to be less healthier. And this has implications for the way we work and for workers' mental health and well-being. Now, if we quantify the impact of social determinants of health, we can see that 50% of our health outcomes is explained by social determinants, and the other half can be explained by health behaviors of healthcare access. So with this example, you can see clearly how social determinants can outweigh these other factors when it comes to their impact on health and well-being. But this also means that having a healthy lifestyle requires more than just having self-discipline or motivation to change health behaviors. You really need to have this system in place to have a healthy lifestyle. And just to give you an example, individuals that live, for example, in a safe neighborhood with access to healthy food and green spaces are going to be individuals that are going to have very different health outcomes than someone living in a neighborhood that is unsafe and is considered to be a food desert. And from research, we know that these other individuals will have a higher risk of chronic diseases like cardiovascular disease or diabetes or obesity. So if we relate this understanding to work as a key social determinant of health, this means that organizational practices and policies that support healthy work environments can have significant benefits on workers' mental health and well-being. Now, beyond the social determinants of health, when we think about employment, it's important to acknowledge that we have these structural factors or structural forces that, like governance, policies, legislation, regulations, that really have a strong influence on shaping our different forms of employment and our work conditions. So in essence, these structural factors can drive actions that can either promote or hinder our access to high quality jobs. And by high quality jobs, I'm referring to jobs that provide you with living wages, protections, job security, that allow you to have some work-life balance, all these important factors for workers' mental health and well-being. So why the emphasis on this sort of big picture understanding? For two reasons. One is that the risk and benefits and experiences of employment are not the same for everyone. It really varies depending on your occupation, the industry, the policies and practices of the organization, but also on the socio-demographic characteristics of the workers, like your age, your gender, race, ethnicity, your level of education. For example, Latino workers are generally overrepresented in blue-collar jobs like construction and agriculture. And these workers are going to have specific occupational hazards, physical and psychosocial stressors that are going to be very different than someone working in other sector. So this understanding really needs to be integrated and to be considered when we think about policies and programs on workers' mental health and well-being. Another important point is that the current business model of creating healthy work environments has really been a strong emphasis on providing employees with wellness programs. And these programs, as Sean mentioned, they're very focused on changing individual behaviors, but not changing the culture and the policies and practices of the organization that actually have a stronger impact on workers' health. So here I wanted to show you some data this is data from the Department of Labor showing you the expenditures on injuries and illnesses versus a prevention-focused approach where we know from research that for every dollar invested on worker safety and health, businesses can see a return of $4 to $6 in reduced cost associated with injuries and illnesses. And this includes reduced costs due to the loss of productivity or medical expenses. So this example, we can see that investing on creating healthy work environments has a clear economic value that benefits both employers and employees. Now let's look at some data. So this is data from the National Alliance on Mental Illness. This is a survey that includes more than 2,000 full-time employees working across different industries in companies with at least 100 employees. And they asked this question: in the past year, have you experienced any of the following at work? And we can see here that more than half felt burned out. They felt overwhelmed. More than a third mentioned that their mental health is being impacted because of their job demands. Their productivity went down, and a quarter of them even consider quitting their job because of their toll to their mental health. So this very simple data is showing you how your work environment can impact your psychological well-being. Now, this is data from the last report of the Michigan Behavioral Risk Factor Surveillance System. And I'm showing you this data from this health-rated health measure. This is a validated survey question that we use in national health surveys and clinical and epidemiological studies because it's a very strong indicator of morbidity and mortality in adult populations. And it's also a survey question that has been found to be associated with biomarkers of chronic disease. So it's a very simple question, but very powerful to give you sort of like a snapshot of the health of a population. And in 2023, 19% of people in Michigan mentioned that their health was fair or poor. So that means that almost 1 in 5 people experience probably significant health challenges to the point that were at higher risk of mortality or reduced life expectancy when compared to those reporting experiencing excellent or very good health. So this deserves some consideration. Another important point here is that you can see that at every income bracket, the lower your socioeconomic position, the worse is your health. This is clearly an example of that concept that I mentioned before about the social gradient. And this data, what is very simple, is really telling us two things. One is the importance of work or employment and income as key social determinants of health. And it's also showing that inequities affect everyone, not only people in the lowest income brackets. And this deserves important considerations because, as I mentioned before, the risk and benefits of employment are not the same for everyone. Now, this is my last slides. This is data from a very interesting study from these authors. It's called a meta-review. A meta-review basically means studies within the studies. The authors compiled data on all of these. All of these are independent studies. So this is the last name of the author with the year of the publication. And you can see that in each of these studies, there were a number of studies analyzed. That's what I mentioned, that is studies within the studies. So these meta reviews are very powerful because you start with thousands of studies, and then you, based on the methodology and the rigorosity of the methodology, you narrow down, and they can provide evidence of the consistency of the results of these different independent studies looking at the same topic. In this case, the authors were looking at the association of these psychosocial work exposures with coronary heart disease. And so the results are reported here as risk ratios. Risk ratios is an epidemiological measure that gives you information about the strength of association of these work exposures with coronary heart disease. And I mark with red crosses all the studies that found positive and statistically significant associations between these work exposures with coronary heart disease. So by not knowing what this means or statistics, you can see that basically all the studies found that these factors, these exposures are associated with coronary heart disease. But I'm going to interpret a couple of them so that you get a sense of the data. By the way, this is a forest plot, which is the way we report this type of analysis. And the black dots are also representing the risk ratios. If you see the metric here at the bottom of the plot. So it's the same information, but let's look some examples. So this is the study, and I select a job strain, which basically means a stressful work environment. And here I'm showing you the study of Kivimaki 2006 with a risk ratio of 1.45. So this means that people exposed to job strain are 45% more likely to develop coronary heart disease compared to people not exposed to job strain. And you can see here that all the studies that look at job strain were statistically significant associated with coronary heart disease. Now let's look at long working hours. And the study of Virtanen in 2012, the authors report a risk ratio of 2.06. So this means that people exposed to long working hours are 106% more likely to develop coronary heart disease than people not exposed to long working hours. And then again, you can see all the studies that look at long working hours with coronary heart disease show statistically significant associations. So that means that the results are not just found by chance, that that these results are actually, we can have a lot of certainty of the association of these factors with coronary heart disease. And the authors actually, is a very interesting study. They look at different health outcomes, but I wanted to show you coronary heart disease because cardiovascular disease is the leading cause of death in the US. A person dies every 35 seconds by cardiovascular disease, according to the American Heart Association and the CDC. Now, let's look at a different outcome, in this case, depression. And I'm showing you the results of bullying behaviors at work because they're very common in the workspace. And here, this study report a risk ratio of 2.82. So this means that people exposed to bullying behaviors at work are 182% more likely to develop depression compared to those not exposed to bullying behaviors at work. And again, what we're seeing here is that all these psychosocial work exposures are associated with depression. So all this data that I show you very quickly is scientific evidence that is showing you how your work environment can have a significant impact on your physical and mental health. Now Sean is gonna complete the presentation.
So within the report, you'll find some tools and resources. I think this is one that's really kind of speaking to our workplaces and to our across the state of Michigan to kind of give us an idea of some of the things that we can be thinking about and working on. And that's looking at prevention. So we always hear about, or we talk about sort of wellness programs, and employers are really looking at those at prevention. But based on the information that Lizbeth shared today, but also in the report, what we're really looking at for prevention is start thinking about the causes of stress, the causes of chronic stress, causes of some of these social determinant impacts, and start thinking through how we can change those. So we'll talk a little bit perhaps at some point about the hierarchy of controls and how we can think about workplace safety and workplace mental health and bring that total worker health concept all together. So we're addressing the psychosocial work hazards, and then certainly protect and promote. And finally, support employees as we continue to do that. Want to go ahead?
Yes, please.
So we're going to continue to develop out this kind of work, and we have some food for thought to start thinking about some of the things that we could or should be doing or thinking about as we head into 2026. We're going to continue to bring a lot more information around this subject, but this report, very well researched, very well thought out, and is intended to help drive our decision-making moving forward through a total worker health lens that we want to try to utilize to make sure that we can continue to grow things. So first and foremost is that, as Lizbeth shared, and you saw in the data, work itself is a key social determinant of health. Continue to picture that person, that 50% at the top, that 50% at the bottom. Most of the top of those things, some of the bottom graph of that person, these are modifiable factors. So work can be modified. We saw that high job strain increases the risk of cardiovascular disease. Job strain is modifiable. Those are things that we can be thinking about and start changing. We want to make sure that we are using evidence-based approaches and sound research. So part of our LEADS program is assessing the interventions to make sure they work, but we want to make sure that we're integrating that into our organizational policies and practices. Prevention is about total worker health, not just simply the individual employee, because we have to put the system together to recognize what's causing these challenges and causing the changes that people are dealing with. And so we want to make sure that we're thinking about it through a total worker health lens that's good for all of us. And then we'll have an impact outside the workplace. So that larger improvements piece there is high quality work, high quality opportunities, high quality jobs. Think about that impact of chronic stress and all those things that are happening there, start putting that together, and we're going to impact our communities as well and start changing Michigan and making us all better and stronger, healthier, and making us just a greater place to be. So we're going to try to jump into as many questions as we have. There's a few things on the data slide that I am totally in love with, and I would love to spend just a half hour talking about those data pieces that Elizabeth shared, because they really start to show what we've been talking about for these last 3 years, that we do have to put this all together. Certainly as an individual, I have a responsibility to take care of myself, but there are things that are impacting my ability to do that we have to put into the system and make sure that we're thinking about. So I think Randall Harrison's going to help us with any questions we may have received. And Randall, go ahead.
Thank you very much, Sean. Thank you very much, Elizabeth. That was great information about that wonderful report. So please, I'm just going to give you a plug. If you have not looked at it, press release went out today. Wonderful report. But the first question that they have, Sean, is after reviewing parts of the report, what practical steps can small and mid-sized employers take to implement the recommendations in the report, and how soon can they expect a return on their investment? So we're talking about ROI here.
Yeah, so we've been talking for a while that these impacts have a great return. You saw it again in Elizabeth's report, that $4 for every dollar invested. You'll see that over and over again anytime you Google that. You get that through a few different ways. You get it through sort of long run, lower healthcare costs, a couple of other things, but you also get higher productivity, less absenteeism, less tardiness, turnover can go down, recruitment and retention go up. So you really start to see this kind of all come together, and they make a big impact on having a change in the workplace. The question on when you can see those is partly like, how will you see those? So I think some of this work is really recognizing that we have to make changes, but we might not see them right away as visible. So if you look at our original report and some of the presentations we've done before, we talk about this concept of invisible costs. So a lot of workers are feeling burned out. They might have depression. There's these things going on. There's research that shows that they are not going to be as productive. I think logically we all understand that, but they're still going to be at work. So there's going to be a productivity loss that you'll start to see changing over time. Small employers can really start by thinking about what kind of benefits they offer. Do the employees have access to employee assistance programs, but also looking at that hierarchy of controls. Where are we creating the stress? Do we have long working hours? Do we have these conditions like Elizabeth was sharing that are impacting our employees' overall health, that are pushing them toward outcomes like physical health conditions or mental health challenges or conditions? How can we start changing that? Think about how we operate. How do we interact with our employees? So often we think about it as like trying to help Sean, but we really want to think about the system. How do we create the right system that supports employee health and well-being? Elizabeth, do you have anything to add there?
I guess that, prevention is key. And that's what I show you, that example on private businesses, expenditures on injuries and illnesses. You saw the cost on millions of dollars versus a prevention focused approach. So I think that's why in this report, we really want to emphasize the importance of prevention and promotion of health. Mm-hmm.
Thank you very much, Lizbeth. So this question is for you or Sean. And this is more so speaking from a leadership standpoint. How can organizational leaders effectively model mental health support without crossing into areas that may feel intrusive or personal to employees?
Yeah, sure. So one easy thing that we can do is to share our stories. So if we've had challenges, I've shared mine before, make sure that we start breaking down that stigma. The other thing we can do as leaders is start thinking about the things that we do. So one thing we talk a lot about, it was in our TechnoStress webinars too, is that a lot of folks catch up on their email after regular working hours. And if you're in a leadership position and you send that email, even if it says, don't worry about this till tomorrow, I've seen people with little tags that say, just because I work weird hours doesn't mean you have to. That doesn't matter. The folks that you are leading are going to see that and get stressed and feel like they have to respond, even if you said that. So they're still going to read the email. Maybe they don't respond that night, but they're going to be thinking about it that night and feel like they have to react. So we can start changing that. Make sure that we're using our time off. Make sure we're allowing others to use their time off. Make sure if we need a mental health day, we take it, and that we make it okay for others to do that. So you can start modeling how you are taking care of yourself and start thinking about the pressures you might be creating for others and start changing that. So don't send the email at 5:06, schedule it for 8 a.m. the next day. You can do that through Outlook, pretty easy to do. Just kind of start doing those types of things. And then certainly you'll see in the news a lot, start handling all these meetings. There's probably too many meetings, start managing those a little bit differently. But a big part of it, as Lizbeth shared, is going to be thinking about how you work and where that stress is coming from. You can't get rid of all stress, but we can get rid of stress that we don't need to be adding.
Thank you very much, Sean. So we are right at time. So we're going to address one more question. So this person look like they have been attending our monthly webinars that we do every month. And they say that there may not be a lot of examples of Michigan employers that have embedded these policies into their workplace culture yet, but we do have a pilot program right now that should be starting within the next month or so. What is the department looking to learn at this point, engaging in this pilot and helping Michigan employers going forward?
Yeah, first and foremost, we want to try to find interventions that work. So our belief through all of the years we've been doing this is that it's not a C-suite leadership only thing. It's not an employee only thing. You have to do it all. So part of the LEADS program is every employee type training, some leadership focus, some HR focus, and kind of building the whole system together. So that is something that we want to do. We also are looking to ensure that whatever these interventions are, whether it's respectful workplaces, dealing with workplace bullying and harassment, you saw the statistic on what that does to people and why it has to go away. We have some training on mental health intro and some other things and some action labs. We want to make sure they work. There is a lot of great information out there on workplace mental health. If you just Google it, you'll get a million things or more, and it's really hard to figure out what's there. So part of what we're doing with LEADS is try to find the things that work, study them, evaluate them, and make sure that you're updating them to make sure they have an impact, because it's really hard to tell what's good and what's okay. Anything is better than nothing, but we just don't know. So part of the LEADS program is to start to sort that out, and then creating the model so that smaller employers, especially that otherwise couldn't necessarily make these investments, have tools available. The report is one of those tools. The things on our website is one of those tools. And these things that we're trying to do through the LEADS program are designed in that space. So to wrap up, we're at about time. So I really appreciate it. What a great way to close out the year. We gave you the 3-year history, and we're launching the next several year pattern with the report that Lizbeth worked so hard on. Thank you so much, Lizbeth, for your work on the report as well as the presentation today. As you can see, there's a strong connection with stress, work, social determinants. The American Heart Association is focused in on workplace stress because of that relationship to cardiovascular disease. So a lot of things are coming together now to really start getting us to think about how do we put the human back in the human resource and make sure that we're thinking about people holistically. So we're excited on where we've been. We're excited on where we're going, and we appreciate you all so much. We hope you have a happy holiday season, and we will look forward to jumping right back in 2026.